The outbreak spreading across the U.S.
They tell us, socially distance yourself.
So I'm staying home, recording this on my cell phone.
The pandemic is frightening, killing people and stopping much of life.
7 million people ordered to shelter in place.
What's upsetting is that it didn't have to get to this point. It didn't in South Korea.
Thousands of Koreans have driven through this clinic. Takes 10 minutes, and you get results in 2 to 3 days.
Deaths in Korea leveled off. Well, America's have not. A big reason is that Koreans can easily find out if they have the disease.
650 places throughout the country where you can be tested, between hospitals, clinics, and these pop-up drive-through centers.
Koreans know who needs to be isolated and who doesn't. Americans don't know that because
the number of tests available in the United States is nowhere near the national demand.
I just tried to get a patient tested an hour ago and I couldn't.
Because tests were not available, infected people were released from quarantine. They may have infected others. Also, doctors can't be sure where outbreaks are happening.
Without testing kits, we can't properly quarantine people, and we're obviously quarantining people that do not have COVID-19.
Why weren't there enough tests here? Because in America, government wanted complete control.
The CDC decided that it was going to make its own tests.
But the CDC's tests often didn't work. Private companies could have made them. The World Health Organization released information on how to make them. But our government wouldn't allow companies to do that.
When labs try to develop their own tests, they came up against a bureaucratic requirement that forces these labs to seek FDA, quote, emergency use approvals.
And even emergency approvals take months or years.
The machines, hundreds of these machines, are currently in the United States, but
they're not allowed to test for the virus.
Not for coronavirus
because
yet.
You need FDA approval.
Yep.
Last month, the government finally said it would relax its rules. Instead of the months or year-long wait, there would be an expedited approval process. But even that took so long that few independent tests were approved.
We had some very old and obsolete rules that we had to live with.
Finally, last week, the president said, just do it. Ask us for permission later.
Normally, it's like years and years and years.
The FDA announced emergency use authorization of a new on-site test.
Now tests are being made, but that delay has killed people. Other rules prevent doctors from innovating, like trying out new, maybe more efficient ways to evaluate patients, like telemedicine.
Being able to care for people at home with video visits and with remote monitoring.
That might violate patient privacy, said the government. Only last week did officials finally say they'd allow enforcement discretion. Finally, patients can consult doctors without risking getting infections in crowded waiting rooms.
Telemedicine should have been legalized years ago.
And now the pandemic raises a new problem.
There's just only so many people that can provide care, only so many beds that exist.
Yet federal rules actually limit the number of beds allowed in some hospitals. Only last week did the president change that.
The White House is easing some federal regulations to make more hospital beds available.
And if there aren't enough doctors in your state,
we have a shortage of doctors and nurses in South Florida.
It's illegal for a nurse or doctor to come from another state to help. That violates a tangled web of state licensing rules. The president said he would
waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need.
But it turns out he doesn't have the power to override state laws. Now at least some states have announced they will
allow out-of-state licensed physicians in good standing to practice in Massachusetts.
Good. But the time it took to get rid of these rules allowed the virus to spread farther.
After coronavirus passes, we should leave those rules waived. Those and many, many others.